This is News 12 Connecticut, as local news gets.
Why doctors say they're concerned that cancer patients won't get their hands on the medications they need if cuts to Medicare scheduled for January happen. I'm Gillian Neff in Norwalk with your 12 on Health report.
Topping 12 on Health, local cancer doctors are jumping into the healthcare reform fray.
Their complaint, they say they can't afford Medicare reimbursements to drop any lower.
Here's our 12 on Health reporter, Gillian Neff. Gillian?
Well, guys, local doctors who belong to the National Community Oncology Alliance tell me regardless of what happens with healthcare reform, they want to make sure Medicare reimbursements are not slashed to the point where care for cancer patients in Connecticut is compromised. But you can't ignore their agenda. If there's any public plan or other option in healthcare reform, they don't want it modeled after the Medicare reimbursement system because they say the payments are not sufficient. Not even this serene setting in Whittingham Cancer Center's courtyard can cure Dr. Richard Frank's agita today.
We're saying don't cut Medicare. Why every year do we have to worry about this? I just want to be a doctor. I just want to tell my patients this is the best treatment for you, not, what's your insurance and how are we going to pay for it.
Dr. Frank and 70 other cancer doctors in Connecticut sent this letter to lawmakers asking for help.
Please look at the facts of the matter. Please petition Medicare and our government.
They warn that Medicare cuts scheduled for January,
estimated at between 20 to 40%,
will have catastrophic consequences.
We always find a way here. We never turn a patient away. And it's heartbreaking to say that things may have to change if these dramatic reductions go through.
He says 6 months of medication alone can cost $50,000. For example, this bottle of breast cancer medication costs about $5,000.
If they're in Medicare Part D and they're in their donut hole, they have to pay $3,000 just to get that. In the process of revamping the healthcare system, what's being forgotten is that cancer care is going to be squelched unless changes are made.
And that's, of course, the doctor's point of view. In response to the letter, Southwestern Connecticut Congressman Jim Himes, who has been working alongside President Obama to promote health care reform, tells News 12 Connecticut he agrees that Medicare reimbursement rates should not be lowered and that the current Medicare payment system is badly in need of reform. Himes says he is co-sponsoring a bill that aims to correct a technical flaw in how Medicare payments for cancer drugs and other treatments are calculated.